Good morning and welcome to day 2 of Maine Public Health Association's 2022 annual meeting, Adapting in Times of Adversity, the Role of Public Health in Strengthening Maine's Communities. My name is Becca Bolas and I'm Executive Director of Maine Public Health Association, and I am very excited to be welcoming you and moderating this morning's keynote presentation. And I want to extend our appreciation to Northern Light Health for supporting our keynote speakers this week. We are honored to have Chris Chaniel-Selkett, who serves as chair-elect of the American Public Health Association and as adjunct faculty at Temple University. Chris really exhibits putting public health into practice with the number of various positions she has held at the community and state level in service to public health. She is a volunteer in the Brookline Medical Reserve Corps on the community's emergency response team, as a library trustee, among a number of other positions that she's held in her community. Chris holds a BA in biology and art history from Boston University, and that's also where she graduated from with her Master of Public Health. And she holds a doctorate in political science from Northeastern University. And really across her various academic, professional, and service activities, her focus really has been all in service for various populations. I will also just throw out there a fun fact about Chris, which is that she loves Disney, and she will even plan your Disney vacation for free. Chris Upon a Star. It's a really fun website to look through and to learn about her tips and tricks for traveling the theme, harnessing the power of public health. Thanks again for being here.
Thank you so much. Thank you, Becca. I am so impressed because I don't know if anyone's ever dug and found out that fun fact of me. So it just shows what an outstanding affiliate you all are. I think it's the first one who's ever found out my fun side hobby, which actually grew. It's a long story for another presentation. It actually grew out of a few APHA annual meetings where you kind of get together and talk with people about something that's not public health. So good morning. I can't thank each of you, Heather and Becca, and your sponsors enough for inviting me to spend some time with you early in the morning, right? It's like a Wednesday. And I tried to be one of those people who before the pandemic was like, must be grateful. That is a good thing. You read those self-help books in those magazines. But it actually wasn't really until well into the pandemic when I realized, you know what, let's just give this a real try and not just, follow the magazines or whatever, the self-help books. And it has really helped me. It's helped me to be a little less anxious, more present. Again, I'm a firm believer, of course, in how essential our mental health is to our physical health. I'm thankful to my therapist. Again, another story for another time is how do you find a therapist in a pandemic? Like that is just, we could talk forever about this. I'm thankful to my supportive community of friends and family and colleagues. But again, it's the morning. I'm sharing my morning and my morning coffee with you. I hope you're having your morning coffee or tea or beverage, water of choice. But if it's okay, if you can just indulge me a moment to get some gratitude going. I know that I have just sprung this on you. So you're probably like, I am barely like getting my coffee together or my tea. So I'm going to go first and feel free to put in the chat. And our fearless leader, Becca, will let us know some things that you're grateful for if you're comfortable, sharing. So again, this is a little bit about my good morning, getting to know you. Okay, so we're all concerned about climate change, right? And I get it. Whew, and some days I feel like it could overwhelm me, right? Like it's just too much. But nope, got to take a moment, got to be grateful. I'm really thankful this morning. It's a beautiful fall day. I'm here in Boston, in Massachusetts, in Brookline. And I had a beautiful walk. This is only one of my puppies because it's a better picture. I'm not a photographer. And I got to go for a great walk. And I'm thankful for the ability, the time, and honestly, the opportunity to go on this walk, to see the leaves change, to be here for another season that passes. So if you don't mind and you feel comfortable, feel free to chat, and Becca will be happy to share these moments of gratitude, or maybe Becca will go first, put her on the spot. Because I just feel like I'm starting my morning with you. I am so thankful for that. And I know that when I put that in my mindset, just carries me a little bit better throughout the day. So I'm going to turn it over to Becca.
I'm with you, Chris. We have a dog that we love, and my parents also have a dog, and they are best friends. And watching them play with each other and kiss each other and snuggle is just it every day. I just laugh throughout the day watching them interact and be best friends. So I feel very, very grateful for that. And there are some comments coming into the chat. Thankful for crisp fall mornings and warm daytime sun. Grateful for tea, spouse, a walk this morning, friends coming over for dinner tonight. That sounds very fun. Thankful for red maple trees, which are truly stunning right now. We have some more dog lovers and changing leaves, fall time in Maine. Lots of dogs. I'm loving the dogs. And trees, fall time, dinner with friends. I think we're all just really appreciating the season and having our pets. Somebody had red strawberries in their garden this morning. That is a wonderful surprise. This is great. What a nice way to start our morning, Chris. Reflecting on what's brightening our days. Dawn has a grandbaby. COVID vaccines, certainly. 3 gorgeous cats. Thank you, Lonnie. So I think this is wonderful. We're getting a lot of engagement in the chat.
Oh my gosh, is there anything sweeter than a baby snuggling with a cat with some puppies? Like, I know. Throw them all in a pile of leaves or something. I don't know. It's really cute. And strawberries, like whoever has strawberries this morning, like I do not have a green thumb, so I am blown away by your strawberries. And maybe we can catch up at the annual meeting in Boston now, because I'm lucky to keep my kids alive, and the strawberries, I don't know how it's literally October. Like this is the middle of October in Maine. So you go. But thank you. So, and I know that we should try to get to know each other a little bit. I know Becca is so, I need you around especially when my parents are over, because I feel like you make me sound better. So I need you to bring you over to Thanksgiving with me. Especially when we hang out with my surgeon sister. But yeah, there's a professional bio out there, and it sounds good. And you have this super slick, I like to say slick, because I'm just like so blown away by your conference platform. And it lists, my work, my education and all that. But I kind of find, no offense, and we're doing this to be safe, climate change, accessible. These are good things. But a lot of times I really like to meet people in person at conferences, because I feel like that's either where I get to make a new friendship, which I have learned that it's not that easy to make friends as an adult. Sometimes it's not the same thing. But when I have, it's really good. Or like I get to deepen a relationship or friendship with someone I've made. I get to learn something new, and it's just really fun. So I've worked in my local public health department. I teach public health and actually political science courses out and about Massachusetts. I currently teach at Temple, and I advocate and do things. But I thought, because, in a real, like if we were all in one room sitting together, I thought, well, let's share some things to really get to know each other. And I will share 3 things. You might already know this, but if not, you'll know by the end of this hour that I like things in 3s. So I thought I'd share some things in 3s. And then as I'm doing it, if you feel comfortable doing so, feel free to share 1, 2, 3 more things in the chat. And then maybe Becca can lift them up, later. And I'm going to give you time, because there's this like closed captioning delay thing going on. So let me share. So this is a bit about me. I don't have a lot of baby pictures because people didn't have iPhones back in the day when I was born. And I look grumpy in every picture. I don't know what the deal is. I have just like a grumpy baby face, but that's me as a baby with my mom and my dad. So I kind of share this because I'm a daughter of Thai Chinese immigrants, and like I have always known that I was different. You know how you do those breakout diversity equity type things where people are like, when did you know you were whatever? And I was like, I always knew that I was Asian. Like, I don't know what you're talking about. Like it wasn't like an epiphany. But I kind of think honestly that it's hitting me a little differently these days, right? Like I'm part of the sandwich generation. My parents, while they look great here, they still look good, but they're older. And with all of the Asian hate and the fears, like, and they live in Maryland, I'm here in Massachusetts, I get nervous, I can't be there to protect them. I have 3 biracial children. Again, 3 things in 3. I have 3 biracial children, and they look different. But, when you see them, they always look, they're going to be Asian, right? So that's just a little bit about me. Oh, I should have worn my hot pink. So I am grateful to be a woman here in Massachusetts, actually right now, because of the protections that we've sought a lot in this post-Roe world. But, I can't knit. I'm worried, scared, mad, sad, and just kind of about what's happening in our nation. So I do what I can throughout APHA in our reproductive justice efforts, but also locally, I serve as a board member here in Massachusetts for the Planned Parenthood League of Massachusetts. And that's been kind of helpful to me to put my frustration into action. And then 3s, right? Okay. So I'm a mom to 3 kids. I've got Hunter, who's 12, Grayson, who's 11, and Genevieve, who's 7, going on 17. She's going to just break me, I feel like. She's got a lot of fire. And I want her to have strong leadership skills, assertive, amazing, fierce, independent, do what she wants to do, except for when I tell her to do what I want her to do. That's like the one hard thing about it all, right? And I have 2 puppies now, Oswald and Dolly. And it has been a positive experience. I like puns. It's terrible. My kids hate it. I think I'm so punny. But and I'm one of those people that got puppies in the pandemic. Okay, but we're keeping them and all these good things. But like I'm a parent, like many of you out there, caregiver. Wow, we've got COVID, fears of long COVID, bullying, harassment, school shootings, like just it's a lot. So I kind of share these things not just because I wanted to put up cute pictures of puppies and kids, right? And my grumpy baby picture, but I share it because it's why I do what I do. All of this is really personal for me. It's personal for me, my family, my community. And it's all health and all policies. And so for me, the political is deeply personal, just as it is for each of you, I'm sure. So if you're comfortable sharing, share with Becca and all of us in the chat now, some bits about you, 1, 2, 3, or more, if you'd like to, and kind of how that bit leads you here into this space this morning. Because I just miss the fact that I can't see, hear, talk, and get to know you a little bit more. So feel free to please share that.
I had to laugh at your grumpy baby picture. There's a video when I'm young, and I've just learned how to walk, and my cousin, who's just a few months younger than me, is not quite there yet. And I love her. I still love her. And I'm so excited about her in this video. And I just am like, I can't even contain my excitement. Like my arms are going and I want to hug her. And so I like waddle over and I hug her, and she's just trying to get her balance in this video. She's like about to fall over. And indeed, she does fall over, and I just take off. And I just think, when you're a kid, like, just so much love and excitement. And I do feel like we as public health professionals bring a lot of that to our work, and I've even felt like that over just the day we had yesterday and the day today, the interaction, the support, the community. We saw it in, even our survey data about how important connection was. And we heard it from Amber yesterday in her keynote presentation. I mean, and with what you're talking about, like with your family and the service you do in your community, so much of it is about connection and care for others. And so when I think about that, it's, it's not three, but it's that, it's caring for others, it's caring for community. And I may not be that excited to see every single person in my life, but there is that love and affection for those that are in our world. So I am appreciative for this time to kind of reflect on that and think about why we do what we do and what's important to us. The comments are starting to come in now, Chris. There's a comment. This is from one of our new board members, actually, who serves currently in the Maine legislature. And her comment is that term limits are frustrating, but she wants to find a way to make a difference. And this is what leads her here today to participate in this.
Thank you for your service as a board member and I'm going to need you to drop in the chat later on again as well, because I'm going to talk about you in the legislature. So thank you.
And I think folks are still reflecting. So as they come in, I'll share those with you. Here we go. We got another one coming in. Oh, nope. Accolades for Denise. So that's great. Yeah, Chris, I'd say keep going and let them kind of reflect on what they're thinking about.
Yeah, and then get to know each other. Like maybe there's these connections that are going to happen on your own in the chat. Like I can't even explain to you. Like I've made friends with folks in conferences, in chats, or online, and we never actually, like, I still haven't met some people, but we exchange holiday cards, we talk, we email, and I still haven't seen them in person. But it's just like they're such a part of my life. So let's do this. So I spent that moment because I wanted to say that I'm here today this morning, and you are all here today this morning with your whole self. And my whole self says to your whole self, thank you. I want to thank you for the many roles that you play, the many, many hats I'm sure that you wear, and the things that you do. And this conference, of course, entitled Adapting in Times of Adversity, the Role of Public Health in Strengthening Maine's Communities. I mean, wow. Oh my goodness. Thank you for all that you have been doing in this adversity, in this uncertainty, or kind of as in, I never want to hear this phrase again, but I think it's so funny, in these unprecedented times, right? Like how many people have said these unprecedented times? It's getting a little worn out now, folks. But today is just day 2 of 3 days of this conference. Again, yesterday, I feel like because I'm the first person, I needed to harken back to day 1 for you a bit and give you some updates for day 3. But this conference is amazing. There was a full day of sharing and learning. And for me, it was really exciting to start off with Admiral Rachel Levine. I felt like she was talking to me. And how, and then you went to ASTO with Amber Williams talking about burnout and how we can improve our resilience and well-being as both individuals and then also as organizations. It's really important. So thank you for everything you're doing as public health leaders, practitioners, in your responses, in really honestly adapting, pivoting, responding, reacting, everything in these unprecedented times, right? So, and you're learning a lot in this conference, like, for example, how South Portland's Board of Health collaborates with the Human Rights Commission, which is really great because I know in my own space, we have a commission of diversity, inclusion, and community relations. It has worked with other human rights commissions, and those collaborations are really beautiful. Also, you learned about the efforts of using StoryMap to get a better understanding of Maine's public health system, to an overview of recovery residencies and how they just came to be in Maine. So it's always just lots of learning, and I'm always learning more about what I don't know. So the rest of the day, which is just day 2 here, you're going to have sessions on public health partnerships, on messaging, communication, rural health, mental health, public health, school systems. I mean, by the end of day 3, you're going to have so many examples from throughout Maine, on the many innovative responses that are happening, that are allowing you as a state, as an organization, as an individual to adapt and react quickly. So I thank you. It's truly a leader and a model, not just for each other within the state, but hopefully we're going to replicate this in many other places. So again, you heard yesterday from Mackenzie Amadei about Maine's public health workforce through the survey results, and you looked at the workforce strengths, their needs, and the impacts of COVID-19 on the workforce. And I just have to say really quickly and lift up, because I know in APHA, our student assembly members are total rock stars. Like, I can't even, like, I learn from them. Someone says, "Oh, you're a mentor to me." I'm like, "I don't know about that. I feel like you're mentoring me half the time." And wow, Mackenzie, like, so incredible. And thank you for putting this together in a context and allowing us to share and reflect and then offer us recommendations. But I'm not going to go in but I just want to say her takeaways really struck a chord with me. And I want to lift it up really quickly. She said, Maine's public health workforce was largely able to adapt to the challenges presented by COVID-19 pandemic, and that members of Maine's public health workforce are mission and value driven and highly dedicated. And I you're not doing work business as usual anymore, right? There's none of that. You're innovating on the fly. You're working to meet this moment. And you're working with traditional and non-traditional partners to make sure that, folks are understanding that this is all public health. That is health in all policies. But then you all aren't just like studying it and analyzing the work, but you're also taking it further. You're looking at the results. You're finding strategies to address barriers. And then you go further because you're like, this is great information. Let's share what we've learned. Then you share your best practices throughout Maine and beyond. So kudos to each of you. And I'm here from the American Public Health Association. I am, honestly, I will say this, can't believe I'm president-elect, because literally it's a dream that I never dreamed of, because as a daughter of immigrants, first person to graduate from college, I can't even believe I'm like sitting here in front of the screen with you. But, I want to say on behalf of APHA, we thank you so much, Maine. You've been a really strong partner in our work. Together, we're able to make great change at the local, state, and national levels as the voice of public health. So we do have to, because, I'm wearing my APHA hat as well this morning. Our advocacy priorities. So here you can see our key advocacy priorities for this year for APHA. We are, a lot of times they repeat year after year because, of course, we always want to address the health impacts of climate change. I would love it if that was already addressed and then we just take it off our list. But you might see it again in 2023, right? But APHA has these toolkits for each state that you can use for your advocacy work. But of course, you may do as well, right? And you're an incredibly involved affiliate. You hold as an affiliate so many leadership roles throughout APHA and really have been a positive part of influencing our affiliate offerings. So thank you as you help us advance these priorities. But again, I had to say, okay, so they said, well, Chris, can you come and give this talk? And I was like, I guess so. Like, I'm only president-elect. I'm not president yet. That's like, hey, I'm going to give it my go. And they said, well, talk about the things that, what are you looking to do in your year? And I said, well, I never even thought I would get to be president-elect. So I'm not sure I thought that far, because I thought that's crazy. But I did. I spent some time, I reflected, and I needed to think about, during my year as I visit affiliates, go across the nation, how could we be strategic together to help our public health field and the nation's health? And it has to kind of be something that's broad enough so that each person can find something that they or their affiliate themselves can engage in to be a part of this positive change. So with these advocacy priorities, and then with your advocacy priorities here in Maine, I want to offer my recommendations for how together we can harness the power of public health for health equity for all. And of course, you know, APHA, our tagline is for science, for action, for health. And if you come to our annual meeting, you will see that we are trying to get you to engage, to collaborate, and grow. So, of course, this morning, I'm going to offer you my 3 recommendations, which are in threes. So first, I want to say we have known and seen many examples, not just in public health and the health arena, but in many spaces of how states are really, and now I'm going to put my political science hat on, laboratories of democracy. And how, as laboratories of democracies, your states have really innovative policy ideas that kind of come to fruition at the state level and then hopefully are adopted and replicated at the federal level. And there's I could do a whole semester, right, teaching you about that. But from my vantage point, I also need to lift up really quickly, or maybe not so quickly, that I see your work here in Maine, the Massachusetts Public Health Association, your work. You are, and I think of this is where the affiliates are. This is where the states are. You're the boots on the ground, right? And I think that you are our public health practitioners who have weathered, adapted to, recovered from, coming back stronger, resilient. I'm getting a little tired of always being resilient, but you are, right? You're a model for other affiliates, truly, literally a model. APHA recognized you with the 2021 Outstanding Affiliate of the Year Award. And you continue to lead both at your state and then therefore at your national level with all the leadership positions you hold in APHA. So thank you. So as I start my term here soon, in about a month, and I head into working on the 3 priorities I have of my presidency and my recommendations for how I think collectively we can harness the power of public health in our workplaces, in our homes, in our spaces, as private citizens, in our roles as public health leaders. I'm hopeful that I'm looking at you, Maine, because you're outstanding, right? Can work with me and really can help APHA with your wisdom, your expertise, and your heart, honestly, because it's all coming from your heart as we dive into the next 150 years of APHA. So my first is, I'm going to ask that we all kind of think about playing for health, which I know sounds like, wait, hold on, didn't I hear this yesterday? Didn't Dr. Shaw and Amber, and I said, they stole my thunder as I was watching their talks on day 1. I almost sent a message to Heather and Becca and said, what is going on? They have taken my priorities. But actually, I thought, that means that my priorities are good because they align, right? We're all working towards the same thing. But of course, and you saw it with McKinsey's survey, we're dealing as a public health field with turnover, retirements, resignations, doing more than we're asked to. I remember Amber said it's not good to work more than 60 hours a week for a lot. And I was like, interesting that we even needed data on that. But yes, that's correct. It's not good, right? And then I appreciated how she talked about moral injury. And how then she brought up, that she reads stories with her twins. And I thought that's really good because the mental toll from this pandemic, as well as the physical toll, you're working so hard, you're not sleeping, you're just operating differently. I guess for me, the one quote silver lining of this pandemic has also been that I have reflected and realized and learned the importance of play. Now I use play really broadly, but here at APHA, we're all for science, right? And evidence-based research. So I'm not going to go into all of it because I'm sure y'all are smarter than I, but there's obviously a wealth of research out there that looks at how play is important. It strengthens your bones, muscles, lungs, heart. It reduces chances of obesity, diabetes, and having high cholesterol. It's good for your mental and emotional health and therefore for your physical health. So it's just good all around, right? We need to do that. And we also have to, and Becca mentioned it again this morning, is care. But she said, we care for others so much. And Dr. Nirav Shah said yesterday, let's also care for ourselves and have this self-compassion. So I want us to use play as an opportunity to also have some self-compassion. I think I'm not, it's a whole nother story I don't have that much time left. But I had learned during this pandemic with some experiences that I cannot care for anyone else, my family, my community, do anything if I'm not well. Right. So we really need to prioritize it. And play can mean many things. It doesn't necessarily mean, walking or running or whatever, because I really don't run. Even if the train is coming, the bus is coming, I'm going to just let it go and wait for the next one. Like, the running is not me. If you see me running, then something wrong. It could be knitting, singing. It could be with your puppies or cuddling with your kitty cats. And President Lisa Carlson, APHA president, has said it's being among the trees. And I love that. And in Maine, you've got a lot of them. So, it's good. Don't forget about that. It's a gift that I try to give to myself, even if it's just a little bit each day. Really try. And I think I used to think before the pandemic, I don't even have time to shower, let alone go for a walk or whatever. And I realized that that's just not good. It's not good. It's not effective for me or anyone. Also, I ask if you can play with others. That'll really help, because as we've seen in this pandemic, the social isolation that has been brought on and the really negative mental health effects of that have been so great. So I'm going to, feel free to share to Becca in the chat and to each other some ways in which you've decided to play all of a sudden in this pandemic, mainly because I kind of want to hear more things that I should try. Now, after these past 2 years, I am all about YOLO. Like, you only live once. I am trying stuff. But I will say, according to my family and my husband, I am not allowed to try slack lines anymore because I ended up with really bad elbow injuries. So I welcome other ideas of things that I should try. I've heard about pickleball, and I kind of want to try that because it sounds really cute. So please feel free to share, what have you done that has helped you take care of yourself and connect with others? So I'll let Becca, chime out whenever people do it, or maybe Becca will tell us something that she does to play for fun.
I also would love to try pickleball. I have not played, but I've seen people play, and it looks very fun. Maybe we can do that in Boston. Chris and I will have, we can go find a court and try it out.
Totally.
Comments are starting to come in. Play on the playground with my son and meet with other parents and families. I got a bike that I don't clip in my pedals, and so I've found that it's more casual, and I'm not stressing out about how fast I'm going. It's much more it's playful. It's more enjoyable. So I think exploring by bike is fun. Mary loves pickleball, so we have some advocates in the chat.
Mary, Mary, you're gonna have to come and help Becca and I in Boston. I don't know anything about pickleball. I just heard it's really fun, says the New York Times.
Looking for sea glass off the coast of Maine with her husband and dogs. Trying to visit all the lighthouses in Maine because there are very many. Someone bought a paddleboard and they use it with their family when visiting, and that way everyone can be on the water together at the same time.
That's awesome. And you must have amazing abs, I think, is just what I'm thinking. Paddleboard. I don't know if I can try that. But yeah,
kayaking, just all sorts of different ways of being outside on the water and visiting different sites across the state. So this is great.
Oh my gosh, you all are so fun. So next time, if the conference is in person again, like I feel like we're going to need to do it outside near a lighthouse with a pickleball court and a kayak, and everyone can share. And then while we're doing it, we'll also talk about best practices and research and evaluation and program implementation, right? um, but I really think that we have gotten to be such a productive, focused society that we forgot to play. Like it was almost a badge of honor, I think, at one point when I was doing my PhD, to talk about how little sleep I got, and how I was just doing it, and it's taken me to this point to realize that that's horrible, not good for my health. And my doctor said sleep is the most important thing, and I didn't really listen until now. So I ask you to please play for health. But also, here's the thing: while you're playing and you're doing your pickleball and you're meeting other people, and like, oh my gosh, I have my 2 puppies. So now I meet people at the dog park and I talk to lots of people who never talked to before. Or when I'm walking my dog, someone else is walking their dog. Somehow we're talking to each other and we've never met before. And we've gotten to know each other. I have now tons of new neighbors. Granted, I only know them as the mom or dad of such and such puppy, but it's been amazing. And I get to share, hey, public health, oh, have you gotten your COVID vaccine? Don't forget about your flu shot. Make your connections, and you can do it, and you can share your love of public health and take care of yourself all at the same time. So that's my first one. My second one, of course, if you have Googled me a bit, is I love reading. Again, another lecture for another semester, is we're all aware of this issue of fake news, which I kind of wish I had never known this phrase before. And we're dealing with issues of health misinformation, book banning, censorship efforts all across the nation. Maybe not specifically where you are, but it's happening. And I'm really just deeply concerned, in doing what I can to support the efforts so that folks can just read and use technology for better and healthier lives. You all know this, right? The digital divide, that's another discussion too, and how that affects our health. But it is a real public health priority for us to combat this misinformation, as we can see, as we are still in this pandemic, right? The health misinformation is really tragic and a critical problem. And I think we need to do more. We need to do more with our reading, our writing, our collaborations, our partnerships with groups and organizations. I want you all, and you have them because you're an outstanding affiliate, but APHA also has them if you ever want them before. Tools on our website on how to write a letter to the op-ed, how to connect with your state or congressperson, right? I want us to be a voice out there loud together, chiming as a choir until everybody knows it. And it becomes part of the vernacular, just as it is now with buckling your seatbelt when you get into the car. It just kind of is the thing you do. And I would really like that. Something I also can't not talk about it is, don't forget about your libraries. Wearing another hat in my life, and I think Becca mentioned it, is I'm a library trustee. I very much advocate for libraries. They are just, that's the one place where everything's free and everyone is welcome, generally speaking. And I see them as partners in public health. There's a whole bunch of research. There are conferences and talks and lectures and books out there. But I'll leave to say this, is that the connection between public libraries and public health is really strong. And let's grow that. You're probably already doing it. Feel free to share in the chat with Becca if you are, if you're already working with your public library, if that was a place maybe that distributed COVID vaccines, for example, with you. But we need to do this. We need to not to forget to read trusted sources, to help people better understand public health, and to know that what are trusted sources, right? And so one thing I wanted to point out, because I just got it in the mail, it's here on the screen. It's Talking Health. I just got it from the De Beaumont Foundation, and it's a really great, super short, because I know we're all busy, tired, you need time for yourselves. But if you have a moment, it's even pretty big font. You can't really see, so it's not going to take too long. but it's great. And I actually really like it. And it all talks about new ways to communicate about public health. And I recommend this because we really need to figure out as a field our messaging. Maybe what it is, and Biden is starting to do it now. I heard about it yesterday, but maybe what it is we need to start figuring out, maybe a lot of our messaging needs to also go out on TikTok, right? Like, who are we reaching? Where are we going? That's another talk. We can do a Q&A on that. And another thing that you might not be aware of, I want to just like key you into it. And if you are aware of it, kudos, because my library trustee self is high-fiving you, is we need to know that across the nation, there are this is obvious. We are intensely politically polarized, right? But it's coming to the point where there are many challenges that are happening to libraries, to school libraries, university libraries, public libraries, and services of book bans. And you might not be aware of it, but even just last year, the American Library Association has had 729 challenges to their materials. And of those many challenges, it has resulted in almost 2,000 individual book challenges. Then, of those that have been removed and challenged, those targeted books, this isn't going to be surprising to you, but I don't think everyone knows about it, and we're not talking about it. Those are all books that either were by or about Black or LGBTQIA+ persons. And as a public health person, as a caregiver, as a woman, person of color, like that's not acceptable. It's not right. It's too much. So we need to be out there supporting, our librarians. And also, unfortunately, as a public health field, you've also felt harassed and dealt with, a lot. Well, feel free to, march on over and talk to your public health librarian, because they've probably also been dealing with the same things right now. It's quite intense. So be aware of it and be a force for change, and know that we are all really working together. The partnerships that come out from libraries and health are just really incredible places, and they're doing some really great things. And if you're actually looking for funding, there's a lot of funding out there that looks specifically at health programming that can be delivered through libraries. Just putting it out there. Happy to connect you. So in something that I just want to quickly tie our reading to our play for health, which I just talked about, is sometimes I read and play for health. And I do this because I'm able to get an audiobook for free through my public library with Hoopla while I walk amongst the trees. So I'm reading and walking and amongst nature, and it's incredible. So listen, think about it. Go to your library. They have everything for free. Libraries, even you can borrow mobile hotspots, induction stoves. They're working on climate change as well, camping equipment, laptops. I mean, it's incredible. Vinyl record players too. It's really incredible. My library even has 3D printers that you can borrow. It's really fascinating. So feel free to let Becca and I know what you're reading these days. Are you an avid library user? Are you maybe personally volunteering or working with your library, or do you in your public health role work with libraries? Feel free to do this, and to just recognize that, yes, I have books up here that are the nation's health, our newspaper, and all these great things. But you can also just read for fun, for pleasure, right? Because I actually learned that my reading on my phone right before I go to bed of the news is not helpful to sleep and bedtime at all. So I don't recommend doing that. But yeah, definitely, let's read for health, read together, work with our libraries. Okay. Is there anything that we should share, Becca?
I think you would like just to hear a couple of the comments in the chat, maybe.
Okay.
There's a comment from Elizabeth about the Caribou, Maine Public Library, which she says is wonderful. They support age-friendly telemedicine services and more, and she loves working with the library. And then Barbara shared that tobacco prevention programs across the state work with their libraries on policies and places to engage youth. And she said libraries rock. So there's other community support for the libraries. And I think many of the ones here, and I'm sure this is true in Mass, also offer free passes to different parks around the state. State parks, the Maine Botanical Gardens, different places like that. And so that can also be a pretty awesome thing about libraries, is using those passes.
Thank you. Yeah,
play. It's your play, so it's great.
I love it. Yeah. You can also borrow. We have a tool library now at my library, which is really great because, like, maybe you only need that saw once for building that thing, and you don't want to buy it, or museum passes through the library. There's just like a whole bunch. And then they just have their free programming, book clubs, meeting people, learning to knit, all these good things. So thank you for sharing. I forgot to mention that. Thank you. About the parks and visiting. Oh, it's really a beautiful partnership. So then my last of three things is to vote for help. So I know it sounds weird because I'm literally have been talking to you now for like 45 minutes or something, but it's really not in my nature to be outspoken. Like, if you knew me as a child, I was like a latchkey kid who like read her Nancy Drew and Babysitter's Club in the corner. I didn't really talk to people. I had because they didn't have thin glasses then. I had real, just huge, I didn't really talk to people. So it's taken me a long time to get to this point. And lots of family and friends and colleagues to help me to try to use my voice. But now I want to try to use my voice to speak for those who I know can't. And I think the best way to do that is to vote, because your health, as you know, and everyone's talked about it, is always on the ballot. And through APHA, of course, it's the only way we can speak for health. And also, early voting has begun in Maine. Feel free to tell me if you've already voted, or tell Becca, because way to go and rock that. And if you're coming to our annual meeting in Boston on November 8th, that is also Election Day. And so we are telling everybody to vote before you get there, please. We know that voting at the state and local level truly affects your social determinants of health, right? It's voting, and it's right there, the state and local governments that are making those decisions about transportation, climate change, land use, educational opportunities, whether you'll have public parks or access to them, or libraries, or will your library ever get renovated, or will it stay the way it is and not have Wi-Fi, or whatever it is, right? We know that these can all improve your health. So voting makes a huge difference. But of course, I don't need to talk too long about it because you're Maine and you know this. It's like literally on your website. Look at my screen here. And you heard yesterday from Becca about how you influenced over 100 bills in the last legislative session. You issue position statements. You do it all. And you also just had, and if you haven't seen it, you can go back and watch it again, or you want to rewatch it or share it with folks. You had a really great webinar with Healthy Democracy and Healthy People, and you have it on your MPHA web YouTube page. Because, Healthy Democracy, Healthy People sees the connection between supporting public health and civic participation and access to voting. If if you vote, you're likely to be healthier. And we know that communities who vote a lot, they generally have better public health. And I say this because I know you probably, because you're here this morning at 9, but there are a lot of folks, and I know this because I've done door knocking, who don't know who their elected officials are. I live in Brookline, which is a town outside of Boston, and regularly people think that the Boston mayor is our elected official. And I have to explain that we're in a totally different form of government. And that is not the case. So again, that kind of harkens back to the Read initiative that I have. But we really need to realize that it's important to vote up and down the ballot, and not just at that presidential election. They make huge differences in our health. Now, so this is something that I think I'm going to have to It's sort of related to the Vote for Health, but maybe Becca can call up your board member. Is better yet, maybe consider running for office, right? So I say this because, as we can see in this pandemic, it's who is on your school board or your school committee. It's who's on your health board that can determine whether or not you will wear a mask, whether kids will wear a mask, whether kids will go to school, when and what will happen locally happens because of who's your local elected official. So a lot of times I think, why not everyone who's in public health also run for office? Oh my gosh, we could make such incredible change. Instead of advocating for policy, we just make policy change. So let's do this. This is a picture of a colleague, State Representative Tammy Gueva, who actually has her PhD in public health from the BU School of Public Health, and she just ran for Lieutenant Governor of Massachusetts. And what I like about it is whenever she was campaigning everywhere, she was talking and connecting the dots to how everything is public health. Transportation is public health. Childcare is public health. It's all public health. So I love it. But I get it. Not everyone wants to run for office. That's totally cool. But help other people run for office. Maybe babysit a candidate's kids. Be a poll worker. We do not have enough poll workers, in particular now in the pandemic. And join, I'm a member of the board of my local League of Women Voters. And it's not just for women, by the way, and they're local and nonpartisan. And then, if you hold an elected local office, please share in the chat, share with Becca. I want to know these powerhouse folks and how you can maybe work together with others and get more to run for office. If you ever need help connecting with other literally nonpartisan organizations on how to run for office, I'm happy to do that. New Politics Academy, for example, is one. And you have it on your website. Is you have questions to ask at your town halls, at your forums, and APHA has them as well. Hold your candidates accountable, and I heard earlier someone was talking about term limits. Yeah, hold them accountable, hold their feet to the fire. They work for you, right? Don't be afraid to go to your state house because it's your house, right? So we know we public health, we know the reforms we need. So it's time to act by voting and getting everyone else to vote. So I think, my time is almost concluding. So my thoughts, so in general, for lack of a better word, through my year as president, I want to change the brand recognition of public health. And I see each of us as brand ambassadors. I mean, if Nike and Target and everybody can have influencers and brand ambassadors, why can't we? We kind of already are as APHA, as MPHA, as public health. I mean, we're the boots on the ground. We're most attuned to what's happening. We know what's needed. And we've seen it. We've seen, for example, local health insurance that reforms that happen in Massachusetts, and then the Affordable Care Act, right? So we can do this. I just don't hesitate ever to reach out to me, to tell me, what I can do to support your efforts or what we can do to support our collective efforts in health equity. And then honestly, what can APHA do? And then really quickly, if you're already a member of APHA, thank you. If not, please do so now. And together we'll make a difference at both the national and the state level. Now, if you're already a member of APHA, that's awesome. Thank you. If not, like Nike, just do it, right? And then the other thing that I love, and I have to mention, is the holidays are approaching. And what's a better gift than a gift of public health, and a gift also that you don't have to worry will clutter up someone's house and collect dust. So consider memberships to MPHA and APHA as really just wonderful gifts of health for your loved ones. It's not just a gift that shows that you make our health a priority and their health a priority, but it's also a gift that allows them access to education, training, information, networking with amazing individuals as yourself. And I know we're heading into, November, but I also really love giving such a gift to my interns and students as well when they graduate. I think it's just really the gift that keeps on giving. So don't hesitate. So feel free to contact me. So let's work, play, read together, share what books you're reading, what you're doing to play, how we can vote better. But then also, hopefully I'll see you real soon in Boston. If not, I'll see you online. We'll be having our 150th anniversary. And I can't thank you enough for this opportunity that you've given me and the time. I am, oh my gosh, good on time. Happy to answer questions. Look forward to being with all of you and doing more. And thank you, Maine Public Health Association. So any questions, any thoughts, any sharing?
Chris, that was great. Thank you for your dynamic and engaging presentation, and for us to be thinking about how we can play, read, and vote and engage in those different processes. And I think your point too about, certainly the importance of voting, but also getting involved in the election process as a poll worker, volunteer, calling people, making sure they have what they need to vote. Do they know where to go? Do they need transportation? Nonpartisan, doesn't need to be a intense confrontational interaction, but just do you have what you need? So I think thinking about all those different components to making sure everyone can vote, I think is very important. So thank you for uplifting those, and I just think it's a good reminder for all of us to think about that. There are so I'm going to go with the second question first, and it's a compliment.
She's laughing. What does that mean?
No, it's a heartwarming question, and the question is, how did you become such a great speaker?
Oh, well, that I so you can't see it because we're on Zoom. I am sweating intensely in my fancy suit jacket. I am super nervous. I had to wake up very early and ground myself with my kids. I'm not a great speaker. I feel like my voice is too high, and all these things, but I'm just trying my best because everyone says you just got to do it. It's like Nike, just do it, right? I'm trying, and I thank you so much. I really appreciate that compliment because I could talk to you about my imposter syndrome problems. That's another talk. It's just like another talk. My therapist and I talk about it.
It was wonderful, Chris. It was I agree with this question. I thought that was very engaging and humorous and very insightful. So the next question is, this person would like more information on funding to help connect public health initiatives and education to libraries. Do you have any ideas about that?
Yeah, absolutely. So I am just so like there are all of these partnerships that are out there. So for example, in Massachusetts, I am on a board with the Massachusetts Board of Library Commissioners on the State Advisory Council. And so we actually have money in that space, like a couple thousands of dollars, where we give to programs that libraries can do. And a lot of them are like about climate change or about health or whatever. And so people write in these pretty simple grants that'll say like, oh, we want to, maybe have a health-based nutrition program that we want to deliver, but like in the library, and then we decide whether to fund it or not. And they have them in different states and places. So, I've had personal experience with this in Massachusetts, but they have them. And then also on the national level, there's a lot from the National Library of Medicine as well. So I think my information is out and about there. There's only one Chris Chanya-Sulkit in the whole world because my dad came from Thailand and they misspelled just his name. So even though he has he has 7 other brothers and sisters, like we're the only Chanya-Sulkit. Everyone else is a Chanya-Supkit. So if you Google, you'll be able to contact me. Feel free to reach out to me. And that's what I want to do, is to connect people, because it's taken me time to make these connections and I'm not hoarding them. I want to give them out to try to connect you, because I have a number of Maine library colleagues who would love to talk to you and or others that do work in this public health, public librarianship space. And then there's also a lot quite out there in the National Library of Medicine, whether it's just funding to support a webinar, or what it is sometimes is maybe you have a program, you're ready to do it. It's, say a webinar or whatever it is, but maybe you want also this other, the National Library of Medicine to just share it with their listserv and their contacts, and to create more connections in that way. And those are things that they can do that don't even have funding, but there's also a lot of funding out there too.
That is very helpful. And there's another question that just came in, and you talked a little bit about this around misinformation and responding to that. And when we look at elections and we see in some places who's running for office, there are people that are going to be that could be secretaries of state or other election officials who may be promoting misinformation. And so does APHA have resources and guidance for people that want to combat that misinformation and respond to that in that particular context?
Yes. So definitely there's a lot out there because we as APHA are, trying to call it out, share it out. But it's kind of hard because at the same time we're nonpartisan. But reach out to our advocacy group, Don Hoppert, in particular, Don Hoppert, DON period HOPPERT at apha.org. Or just contact me and I'll connect you as well. I love them. Like, there have been times when I've been like, I want to testify on this bill at my Massachusetts State House because, we need more, whatever it is, right? And here's like the idea I have. This is my, statement that I'm thinking of putting together. Can you help me? And they will literally work with you, help you maybe add some policies to reference, things like that. Or how do you answer something? Like, that's what they do. So don't hesitate to reach out. If you're a member of APHA, like, use your membership. And if for some reason you contact and you're not hearing back from them because this month they are a little busy, don't hesitate to just contact me. Feel free to reach out to me. I will only not answer the phone if I'm driving, or otherwise on a walk in the trees. But otherwise, like, I want to make sure you get this information because the folks at APHA are incredible folks. We're a member-driven organization and we want to help you. Similarly, I'm sure if you contacted Becca and you had any question about anything Maine, she's ready. She's there. She knows everyone. She's ready to connect you. And also, libraries are great places of they literally have masters in library sciences about strong and trusted resources, about how to combat misinformation. They actually have, like, I've often, when I teach class, bring a librarian into the class to help my students look at what are the sources and how do you use them.
I do the same thing, Chris. I think people underappreciate the value of researching skills in the library, and they don't quite recognize the breadth of resources that are available to them. Well, we're at time, but Chris, I really just want to thank you so much for this very engaging, very thoughtful presentation. And I think just such a helpful reminder for us all to play and to engage in our communities and in areas of public health, these broad areas of public health. And so I just want to thank you for embodying our field in your personal and professional life. So thank you very much. And I want to thank everybody who joined us for our keynote presentation. Our next session will start at 9:40, and our first presentation of that is pushing ahead to new partnerships. And we hope for you to access that, go exit out of this session, go to the conference agenda, and then click on the new one to start the stream. So we will see you back here in just a few minutes. So thank you very much.
Thank you.